So Dr. Beth Frates is the current president of the ACLM. She is a pioneer in lifestyle medicine education, an award-winning teacher at Harvard. So just a small unknown college, right? Currently, she works with patients to help them adopt and sustain healthy habits. Dr. Frates, her interest is in and passion for wellness started well before medical school. When Dr. Frates was 18 years old, she told this story yesterday, her father suffered a heart attack and a stroke. He was only 52 at the time. The event sparked her interest in medicine, psychiatry, and stroke in particular. Dr. Frates went on to graduate magna cum laude from Harvard, majoring in both psychology and biology. Then she attended Stanford Medical School and interned at Mass General Hospital. She completed her residency in the Department of Physical Medicine and Rehabilitation at Harvard, where she served as chief resident. But today we are going to hear where she talked to us about coaches last time, and today we're going to hear about physicians as leaders in the community. So thank you, Beth. We are excited to hear from you.
Oh, thank you so much. It is a delight to be here again. I'm so grateful that I was able to Zoom in. I spent the morning at a Mass Medical Society CME teaching there, so this was allowed me to do both things. So thank you so much. And for those of you in the room, thank you for being here on Friday afternoon. I'm going to try to make this hour very, very worthwhile for you. You know my disclosures, but I have to give them, of course, because here we are at a CME, Scientific Advisory Board of Jenny Craig, as well as on the Medical Advisory Board of Obvious Solutions and Clearing.com. Not going to talk about any of that. I am going to talk about building healthy communities, starting with ourselves. We heard a little bit about Erica Frank from me and John LaPuma, who's also a good friend, how important it is that we care for ourselves. And that's going to empower us to care for others. So we're going to identify effective ways to share lifestyle medicine principles, which you've learned a lot of during this conference, with colleagues in the hospital. I'm going to share with you ways that you can continue your education for free in lifestyle medicine with some free CMEs and opportunities for you. I mentioned coaching, and we talked a little bit about group interventions. I'm going to get into those a little more deeply for you today, which is going to help create healthy communities and also could increase your own satisfaction with your work. We'll look at methods to help medical students and trainees to learn more about lifestyle medicine. I couldn't believe the previous speaker. What a great testimony for lifestyle medicine. That was incredible. And then list ways to help early career attendings with their lifestyles for the very reasons that you heard in the talk previous to mine. Examine the connection between clinician lifestyle and their counseling practices. I will share with you some research that I did when I was a resident that I hope you find interesting and compelling. It is the research article that has gotten the most play of anything I've written, and it has been replicated now 3 or 4 times. So I'm excited to share all this with you. Here we go. We're going to talk about education, we're going to talk about research, and we're going to talk about clinical practice. First thing I want to say is with healthy communities, and we're going to try and work on creating healthy communities from the inside out. So that's from our clinical practice into our own communities and beyond. It's all about connection. You know this as family medicine physicians and healthcare providers that you are in the audience. One of my mentors is Dr. Ned Hallowell. You may know him as the author of Connect or Driven to Distraction. He is a psychiatrist here in Boston. He was at HMS, but then he left and he has his own private practices now. He's very wise, and he talks a lot about the importance of connection. You may remember this from Maslow's hierarchy of needs, and your psychology work will review that also later today. But he talks about 12 vital ties, 12 vital connections for all of us to have as human beings, as patients, as providers. By the way, we're all patients, right? We're providers and we're patients. Here they go. I wonder if you could list all 12. I'm going to try and list some of them. I think you'll be surprised by some of his recommendations. But John LaPuma is going to come back in the room here very shortly. Ready? Not physically, but I mean, as I'm talking about the information. So the past. family of origin, you're going to connect with your immediate family, nature and special places, beauty like art, like music, or the beauty of watching an act of compassion. Sometimes I can get chills just watching another help another human being. Of course, connection with friends and community. We're going to talk a lot about that today. He mentions pets and other animals. Institutions and organizations. I'm deeply connected to lifestyle medicine and the American College of Lifestyle Medicine. I do invite all of you to look at that website and consider becoming a member as well. Ideas and other information, connecting to ideas. So for me, the idea, the information around the power of these 6 pillars of lifestyle medicine: work, mission, and activity, having a purpose. A lot of our burnout, if you look at the literature, is related to losing a sense of purpose. This is Tate Shanafeld at Stanford and his work. So the 11th, we have 12. The 11th is whatever is beyond knowledge. So someone could call this spirituality, someone could call this religion, but something that is beyond knowledge. And then lastly, connection with yourself. It's a really important concept. Now let's get into the well-being of physicians and our community. Because we need to feel well in order to serve the broader community, as you know. I'm not sure if you ever were familiar or if you've ever seen this. It is from Tate Shanafeld and the folks over at Stanford that have done a great job in looking at physician well-being. So the efficiency of practice, personal resilience, a lot of this is around lifestyle medicine topics, and then creating a culture of wellness or a community of wellness. So thinking about efficiency of practice, you know this. You ask physicians what's bugging them, what is frustrating them, what is decreasing their productivity and efficiency, the EMR, administrative tasks, email overload, call center issues, test result delays, poor communication. Now, for personal resilience, you know these 6 pillars of lifestyle medicine: routine physical exercise, nutritious food, restorative sleep, stress resilience, positive social connection, and avoidance of risky substances. This culture of wellness, this community of wellness, what we want to try to do together with our practice, with our hospitals, with our medical schools, with our trainees. So honoring work-life balance is a huge part of this. So perhaps we all agree not to send emails during the weekend or after 5 p.m. I know this is a change in culture, but you also know that you can do send later on your email. You can schedule send things. So you may be thinking about it, but you don't have to send it to anyone until maybe the work day. You're right, Monday through Friday. Cultivating high quality connections. This is a pillar of lifestyle medicine, and working to do this in the workplace will help us. Mentoring with well-being. I'd love to share with you in a little bit later in this presentation a case demonstration we did at the Department of Surgery at Mass General Hospital in including well-being in the mentoring sessions for surgeons, where they're also talking about their surgeries, about their research, about their teaching. And then, well, what about your lifestyle? What about well-being? Creating hospital-wide opportunities to enjoy the joy of the 6 pillars of lifestyle medicine. I love this group and I wish I were there in person because I heard you going hiking. It's a beautiful day out there. So again, thank you for being in the room and being with us on this beautiful day in Utah. And then honoring the health professional wellness hierarchy. What's that, you may say? Here it is. This was before COVID, actually. We learned about this hierarchy before COVID. It comes into play even more so today than before COVID. But this is Shapiro and colleagues. This is the well-being of the healthcare provider. The basics. So this is, I'm hydrated, have access to food and time to eat. I have enough sleep. This is what we need at the foundation for us to be healthy and well, to help each other, our communities, our patients, and the broader community. And then I have access to bathrooms, very, very basic. No depression or anxiety, a little bit more challenging, but remove the stigma of getting help for mental health from healthcare professionals is very important. Free of substance use. Do not have suicidal thoughts. I have time and space to breastfeed if you are, of course, in that position. Safety, that's the next thing. So I'm physically safe, patients are safe, job is secure, future predictable. That's hard at any time. And then respect. This is key, respect. There's a basic level of mutual respect and inclusion. If you're going to create a healthy community, we need this part of the pyramid to be locked in tight. Basic level of mutual respect and inclusion. My family time is respected. I'm not hassled by IT or the electronic medical record or bureaucracy. Now, this is a hard one. We're going to have to work on this with our hospital administrators. And then objects and processes work. Cultural violations are addressed. Next level, appreciation. We all long to be appreciated for what we do in multiple ways, not just compensation, but yes, compensation is one. I'm noticed and appreciated. I'm corrected. And then, of course, appreciation. And then contribute. This is what we're looking for as healthcare providers. I have time, autonomy, and resources to heal patients. I have time to think and contribute. So the AMA has gotten really involved in physician well-being. If you're not familiar with this AMA website, I'd like to draw your attention to it. AMA Stop That, Start This checklist. And you can bring this to your administrators or chair, or if you're a chair of a department yourself or an administrator, you can take a look at these. Very important. Stop the notifications of scheduled appointments. Ask IT department to help turn off the inbox notifications. Directly answering patient inquiries that come through the patient portals, that's got to stop. We got to develop a standard protocol to allow team members to address patient portal messages that can be addressed by a non-physician, non-clinician. Then we've got to stop being caught off guard by patients' unexpected agenda items by implementing a pre-appointment questionnaire. You can get onto this website and click on these, and these are resources that you can utilize when you go back to your practice. Stop reviewing lab results with patients after their appointment via an additional phone call or patient portal message that's taking up our time. Develop a pre-visit lab protocol. And then in terms of refilling prescriptions, get it something that is more formatted. This is the way the AMA puts it. Stop resigning yourself to stupid stuff in your day-to-day just because that's how it was. Instead, they recommend engage your local leaders to start getting rid of the stupid stuff. Again, you can click on this and see their options and resources. So when we're talking about education, we're talking about that important connection of those vital ties from Ned Hallowell. Connection with ideas, information, work, mission, and yes, colleagues. The traditional way of doing this, we can bring this together for our 6 pillars of lifestyle medicine. And I started doing this, as you know, in 2008 over at Harvard Medical School in Spalding Rehab Hospital in the Department of Physical Medicine and Rehabilitation as I trained in physiatry. A lot of people do mix that up with psychiatry, but I'm not a psychiatrist. I've trained physiatrist. All right. So I started doing grand rounds early on in 2008 about the 6 pillars. Well, they loved hearing about exercise. So I could bring this in to help them. And I will share with you, because at that time in 2000, when I was a resident, this is one of my last slides, but I have to bring it up right now. We learned after surveying primary care physicians that are internists, pediatricians, family docs. We surveyed them around the country. We asked them, do you exercise? Do you strength train? Do you do aerobic training? Then we asked them, do you counsel on exercise? Do you counsel on strength training? Do you counsel on aerobic training? And guess what we found? I think you're guessing we found a correlation, but we didn't expect this correlation. The correlation we found is if the physician exercised, they counseled on it. If they did strength training, they counseled on it. If they didn't do strength training, they didn't counsel on it. If they did aerobic training, counseled on it, same thing. Didn't do aerobic training, didn't counsel on it. So I started doing grand rounds shortly after that at my hospital and any hospital. In fact, I went to MGH and did it over there too, to talk about the importance of exercise and how you could benefit from exercise and write an exercise prescription. So traditional methods of sharing our well-being information or lifestyle medicine information you've learned throughout this entire time in this amazing conference, you could go back and consider doing grand rounds, or when you have your team meeting, you can bring up some of the information you learned about nature from Dr. LaPuma or others. Create a CME. Well, right here we have Scott's example of creating an incredible CME. Bringing in some leaders. You could do one live or online. Invite colleagues. If you're starting your lifestyle medicine work or you want to start a project, invite colleagues at work who are interested in exercise, nutrition, sleep, social connection. And then do some research in this area and publish so that we get more and more of this spreading of the good news of lifestyle medicine and its power to help patients and providers alike. Publishing case studies. Yes, we all want randomized controlled trials, but even publishing case studies or case demonstrations, which I'll share with you. I shared the case study with you in my coaching yesterday, and I mentioned the importance of the literature around coaching. It's important for our endeavors in lifestyle medicine. There's non-traditional ways of going about this. So I started this a long time ago. Now I'm in the non-traditional ways. So we started a wellness committee. Maybe some of you have a wellness committee in your hospital right now. We started one a couple years ago at Spalding Rehabilitation Hospital. This Department of Surgery in Mass General Hospital, they started a wellness committee in 2018 and invited me to join it back then. Now I'm actually part of their Department of Surgery. As a person trained in physiatry and a lifestyle medicine specialist, they invited me, and I have a job there as the director of lifestyle medicine and wellness to try to help them have a well community, a community of physicians that can enjoy a sense of well-being. So we started wellness rounds instead of grand rounds, the traditional grand rounds. Here, wellness rounds. For the first time, 2022, we got this through Spalding Rehabilitation Hospital with CME. So we're not taking up extra time. We know when grand rounds are at Spalding Rehab Hospital. They're on Fridays at noon. That was today at noon. And we talk about lifestyle medicine topics. Lifestyle. So we did exercise. We did social connection. We also covered self-compassion, mindfulness. Hopefully, we do have a colleague working on getting lifestyle medicine consults into the hospital so that they can actually see patients inpatient who are stroke survivors or heart attack survivors before they're even discharged from the hospital. Another new thing I started at Harvard Medical School is a medical school wide. So we have several hospitals here in Boston that are Harvard Medical School, and we have Journal Club now for all of the hospitals because it's online. One good thing that came out of COVID is we all learned we can get along online and we can learn online together. So you could consider, if you're very interested in lifestyle medicine, having a journal club because we all want the research. We want the latest research. It's an idea for you. There's a lot of podcasts. I don't do one, but there's a lot of podcasts in lifestyle medicine topics. You could consider joining one, listening to one, or doing one yourself, depending. And everyone's on social media these days. Spalding had us get on social media in 2017. I remember I didn't even know how to tweet. But they told us we need to be putting out the truth. We need to be putting out good research. We need to be putting out healthy messages. So, of course, there's other things, Instagram and I don't know, TikTok. I'm not sure about that stuff. But LinkedIn and posts on LinkedIn. ACLM has done some Instagram Live, and other physicians do that as a way of communicating these healthy behaviors to the public as well as to communities of physicians. And now even Harvard Medical School has an educational channel that's on YouTube. They have a YouTube educational channel, Harvard Medical School. I invite you to visit that because you could get some lifestyle medicine information if after this you're so enthusiastic that you want to learn more. And here is a resource from the American College of Lifestyle Medicine that's free. I'm going to give you lots of free resources right now. This is the LM 101 curriculum. You can get 12 decks of slides on all these 6 pillars. And these decks are about 100 to 200 slides long, okay? You're going to get for the 6 pillars and more, by the way, there's 12 decks available right here for free. Download at the lifestylemedicine.org website. And all you have to do is type in LM 101. And then you'll see here, member download. If you're not a member, don't worry. Just do faculty application. And then you could also download the syllabus for an LM 101 curriculum. Why do I mention this to you? Because if you want to go back and you want to talk to your colleagues, you want to talk to patients, you can use these resources that have already been developed. So I shared my decks since 2008 or so, since I've been giving lectures at the college level, master's level. You can see it's research based. You can use some for your research. You can even use some for community. When you want to teach the community, just pick out the slides you like and utilize them. If you want to give grand rounds, you could probably pick out of the 200 times 12 slide decks that are in there, some slides that you can use. Now, another important thing is eating on a budget. This whole thing of lifestyle medicine, people sometimes say, but this is only for the wealthy, but it's not. It's for everyone. It's for everyone. And we have resources at lifestylemedicine.org to share with you about eating on a budget, and patient resources that show whole food, plant-based eating and what it entails. So I encourage you to use that. Now, when we're building healthy communities, as we have already talked about, we're starting from the inside out. We need to help ourselves be healthy, have healthy communities, and then broaden this to our patients and the greater population. And I'll give you ways to do that. The social determinants of health are critical for us to pay attention to. As you well know, education, access and quality, healthcare access and quality, this is really where we live. Neighborhood and built environment, we have to take this into consideration when we say go for a walk. I'm here in Boston. There's places like Dorchester and East Boston. In Dorchester, there are shootings. I'm not going to tell a patient to go out for a walk. I'm going to understand where they are and say, where could you safely engage in movement? Social and community context, economic stability. One thing that's really important in lifestyle medicine is to consider food insecurity screening, nutrition insecurity screening. So you may be familiar with these questions. It's, was this question true, often true, sometimes true, or never true for your household in the past 12 months? The questions are we worried whether our food would run out, whether before we got money to buy more? The food we bought just didn't last and we didn't have money to get more. Just asking these two questions can really help people. And by the way, there are medical students who fall under food insecurity. So asking these questions of our own community members, our own trainees, our own students, who are our future leaders, is really important. Hunger and Health Feeding America. This is a great website. If you want to look into this, we work with this in our medical school and we work to connect with our food pantries. So we have a revered food pantry at MGH that is whole food, plant-based. A lot of food pantries are not paying attention to the lifestyle medicine optimal diet that we're looking at. We have our Harvard Lifestyle Medicine Interest Group that actually raises money so that the Revere Food Pantry can provide healthy options. So we're teaching the students about the healthy options and we're asking them to bring this forward into their communities. Here's a free opportunity. I'm going to say this a lot today, but if you want to learn more about lifestyle medicine, you can get 5.5 CME CE hours right here, essential bundle right here. So this is usually, I think, $220. I'm not quite sure, but anyway, it's $0 for you. So just go, if you actually Google Essential Bundle American College of Lifestyle Medicine White House, then you'll get to this link and you will be able to take this 5.5 CME on nutrition as medicine free. So I encourage you to do so. You have these slides. So if you're not getting it right now, you will get these slides. You will get the link when you get your slides. Another option for you for free, CME on lifestyle medicine. The Department of Surgery, as I told you, I've been working there as the director of lifestyle medicine and wellness since they gave me the post in 2020. And then they got funding for me to do an online CME, which I did, about the pillars of lifestyle medicine. And they got the funding from a grant, and thus it's free for you and everyone else. So here you are, free. Spalding Rehabilitation Network, improving provider health and happiness. You don't have to pay. You just sign in as a guest and it is free for you. And you have modules on physical activity, nutrition, stress, sleep, sense of purpose, attitude, goal setting, social connections, energy management, and more. So I encourage you to think about that. This CME counts for maintenance of certification for the American Board of Lifestyle Medicine. You may want to look at the American Board of Lifestyle Medicine and consider getting certified. It's entirely up to you. As we know, one opportunity leads to another. And I told you after doing that CME, well, Harvard started a YouTube channel, Harvard Medical School YouTube channel for medical education. They asked me to do a series of interviews with them on the pillars of lifestyle medicine. So you can learn about social connection, exercise, sleep, stress, all in these short 1 minute, 2 minute. I think that the biggest one is exercise, which is 10 minutes. And you can also share these with your patients, and it can be patient education, all free, just right on the YouTube site. Now, here's Dr. Walter Willett. You may or may not be familiar with him. He is, well, my nutrition guru here. I talked about the Harvard Healthy Plate. I generally recommend that for patients who are starting out from the SAD diet, standard American diet, trying to move over to a healthy diet. And then the American College of Lifestyle Medicine has the whole food plant predominant plate, which is very similar to Walter Willett's. But he was the department chair for nutrition at the School of Public Health for 2 decades or more. He's left the post, but still very involved. And Frank Hugh has taken over. We were fortunate enough to get him to come for our first journal club. And this is one of the things I recommend for building community in this area. If you're interested in healthy living, having a wellness or well-being committee and community in your hospital, having a journal club is key. It builds community. You're going to find people coming out of the woodwork. We have people from the BI, from the Brigham, from Mass General, from Cambridge Alliance Hospital, all these different hospitals coming together on Zoom to talk about the 6 pillars of lifestyle medicine. And it allows for critical thinking, sharing of our ideas, and fostering this love of learning. We bring in the medical students. In fact, for this one, Alexis Smith, she's now Dr. Alexis Smith, going to graduate and go into psychiatry. But she was the lifestyle medicine interest group leader who did the slides to work along with the famous Dr. Walter Willett. So that was exciting. We also got CME for these journal clubs. So people who come, not only do they get the information, but they get to have their CME. It also cultivates connections. I learned that from Dr. Ed Hundert, who's the Dean of Students at Harvard Medical School. I said, I really want to get our community together, our community of lifestyle medicine leaders that we now have at Harvard. I mean, back in 2008, there were just about 2 of us. Well, now we have a whole community of board certified lifestyle medicine practitioners, clinicians at Harvard. And I said, I want to get everyone together. Maybe we could all go for a dinner. And he said, a dinner? No, you're not going to all go together for a dinner. You have to have a project that you can all come around. That's how you create community. Get a project going where everybody wants to participate. And that's how we came up with doing the journal club. So I owe that idea to Dr. Ed Hundert. Now, this wellness committee, wellness rounds, as you heard about, this happened just recently in 2022. I hope you could go back to your institution and get one much quicker than it took me. You need that buy-in from the department chairs, though. Dr. Keith Lillimon in the Department of Surgery and Dr. Rasa Font in the Department of Physical Medicine and Rehab. They were involved and they were enthusiastic and they endorsed it. So it happened. Then you need your wellness ambassadors. You need a bunch of physiatrists on one side. You need a bunch of surgeons in the other department to get on the committee with you and want to make change. It's got to be energizing activities. Everybody wants a little bit of joy. So when we inject the joy of lifestyle medicine, we usually get good results. And we have to make sure what we're doing doesn't cause them to feel like they have no time. So we like to do these things either at lunch or when they would be at work or have some free time, rather than putting this in the evening. Sometimes it does happen in the evenings because that's the time everybody says works best. We like to try and do it during the day. All right. So here's just some options. You can conduct walking meetings. Just when you're meeting with a colleague now, you can say, hey, you want to go outside and take a walk while we meet? Stanford study, great study, showed that 20 minutes of walking versus 20 minutes of sitting. If you walk for 20 minutes, your divergent thinking goes up something like 64%. Divergent thinking is out of the box thinking, as you know. Get outside when you can. Nature is medicine. Dr. LaPuma in the room again. Start a community garden. Dr. LaPuma in the room again. But we have a community garden. It's fun. And if you get your colleagues to do this in the hospital and you can get the buy-in, then you get a garden. It's rewarding on many, many fronts. Having cooking demonstrations. I've connected with the chef at Spalding in the dining room, and he'll do cooking demonstrations. Pre-COVID, he did them for me with my group visits, which we'll talk about in a minute. And then we have a quiet room now for reflection, mindfulness, meditation, for healthcare providers, physicians, anyone who wants to get out of the hustle and bustle and have some quiet time. There's a small room allocated for this. Offering yoga, we've tried that, and people are interested. Again, lunchtime is a good time to do this, Tai Chi or other such classes on site. And then, of course, offering healthy options for team meetings instead of, well, we used to get, of course, pizza and donuts and but this has changed now. We have a Sweet Greens outpost for the surgeons in the Department of Surgery at Mass General. There is Sweet Greens. They can order it on an app, and it actually comes to the hospital, and there's an outpost in the hospital. We arranged this for them to make it easier to get healthy lunches. And built a sense of community. We've got to keep the sense of community. We've got to bring it back because COVID has separated us. So a lot of the wellness work in both the Department of Surgery and the Department of Physical Medicine and Rehab, where I'm working now, is about building community, because Maslow's hierarchy of needs: physiologic needs, air, water, food, safety needs, so shelter, and then love and belonging needs. This is what we're missing. And you look at the literature, JAMA viewpoint, we emphasize that social connectedness is a basic human need that, when lost, leads to burnout. So we know this from 2020. Another excerpt from some research for you. Strong peer support in a small rural group practice brings friendship, pride, and loyalty, all of which motivate retention. We have to honor this. Connection is medicine. Groups that provide us with a sense of place, purpose, and belonging tend to be good for us psychologically. They give us a sense of grounding and imbue our lives with meaning. They make us feel distinctive and special, efficacious and successful. They enhance our self-esteem and sense of worth. So joining a community of lifestyle medicine physicians, I know you have family medicine physician communities, creating community in your own hospital. For me, American College of Lifestyle Medicine has been a wonderful community for everything that is outlined right here. And this is from the medical literature. So creating community, talked about those group visits, and I just want to dive into those a little bit for you in case some people are interested and they got their interest was piqued yesterday. I want to follow up on it. So over a decade ago, I had seen the literature on group visits, and as you know, with my dad's heart attack and stroke, and then my residency in physiatry, because I wanted to take care of stroke patients, and led me into lifestyle medicine in this current career. But I have a fondness and an affinity for stroke survivors, and I think I always will. So what I want to share with you there is I looked at the literature, saw that group visits helped people adopt healthy lifestyles and change behavior. So I went to my chairman, went to the head of the stroke rehabilitation unit at Spalding, and I said, will you let me pilot this? And they did let me pilot it. Then I wrote it up. It's important to get it into the research. And ever since, I've been running stroke group lifestyle interventions. Now, you're not going to be surprised to know I do stroke and caregivers. It's not the way it's always been done in the literature. And I'm going to tell you, the first group intervention was done in 1907 at Mass General Hospital by Joseph Pratt for tuberculosis patients. So this is not a new concept, but it's getting new energy. And there was a lot of research, even back in 2006, a lot of research to report on as a review. And this is what sparked me to put this together in 2012. Behavior change, improved health behaviors, and better medication compliance with those in the group visit arm of a study. Psychological changes, increased self-efficacy, that belief that they can do it, that they can change. I talked about during the coaching session yesterday. Improved quality of life in these group visits. Now you're saying, what about labs? Labs are very important. Yes. reduced blood pressure and cholesterol, improved control of mean blood glucose, and yes, decreased hemoglobin A1C in diabetic patients with group visits. And then physical exam, reduced obesity. Now, healthcare costs, everyone is interested in this. Of course, it's a very important. Decreased emergency and urgent care visits with those patients that were in the group visits. I mentioned this yesterday. Increased patient satisfaction, improved doctor-patient relations, and improved physician satisfaction. Lifestyle medicine has helped many people be reinvigorated in their practice. And these group visits do help. One physician, 12 patients. The research shows 8 to 12 patients. What has been studied in the past? Chronically ill patients, chronically ill low-income patients. We're thinking of everyone possible and making it all accessible and inclusive. Diabetic patients, coronary artery disease patients, headache patients, frail elderly, children, mother-infant pairs, all patients in the practice. And this is what the review studies show. Patients appreciate the physician's unhurriedness, time spent with a physician, and overall quality of care, because remember, these can go 60 to 90 minutes. All those 12 patients are with their healthcare provider for an hour and a half. They can't believe it. They love it. They love the time with the physician. And physicians providing group well visits covered significantly more American Academy of Pediatrics recommended content in their education sessions than did the control physicians, particularly around safety, nutrition, behavior development, and sleep. So in other words, this was with pediatricians in this study, but think about it. You can cover a whole lot more with 12 patients in that 60 to 90 minutes than you could possibly do in your 10, 15-minute visit. Physicians who participated in these types of visits reported they really enjoyed them and were extremely satisfied with their ability to treat group visit patients. Group visits have been shown to increase physician productivity and may in turn increase physician satisfaction. More and more, that was one of the original reviews. More and more reviews very much targeted to patients with diabetes and patients with heart disease. But I'm just pointing this out. Their recent literature has gotten attention for group visits, again in diabetes. Here, an innovative model to reduce health disparities among Latinxes with diabetes. Here, we have patient satisfaction, physician productivity, and shared medical appointments for vitiligo. Dermatologists are getting into these group visits because they're so powerful. Breast cancer survivors. I have a colleague here, Amy Commander's, working really hard putting this together with breast cancer survivors. And then obesity. So there's a lot of opportunity here. Now, many of you are family practice physicians, so I want to point out that, in fact, it's the AAFP that has talked a lot about the coding. Now, this is from the aafp.org. You can Google this. You have this in your slides. But it is important, as I said yesterday, that you connect with your billing department, because here you can even see we recommend that you ask for these instructions in writing and keep them on file as you would any other advice from a payer. So they're recommending 99213, 99214, 99215, but you can use code 99078. That's the educational services, but you must work this out with your billing department. So how does this work with creating this community of healthy patients, right? So you can do it a lot of ways. I started with just straight 4 weeks, weekly 4-week visits for this lifestyle medicine intervention in stroke survivors. Had increased vegetable intake, increased physical activity minutes. And one of those people, there were 8 in my first pilot, one even quit smoking. So this is why I got more funding, because we kept getting good results. So then I went to a 12-month program. This is not the traditional way these are held. Usually these are 6 to 12-week programs, but I tried a 12-month program, creating community again. That's what I thought it would take. And it certainly did create a community of stroke survivors and caregivers. We talked about the body and the mind, physical activity, nutrition, sleep, stress management, all 6 pillars, plus attitude, purpose, energy. And I would meet every first and second Thursday of the month. I did 2 hours, again, 60 to 90 minutes. You can go up to 2 hours if you have that time. I did, and I wanted to check into this program and see how it would work. Each session was about half education. They wanted the education. I asked what they wanted. They wanted the research. I gave it to them. Then I had them share for half. I did the coaching for half of it. There was an emphasis on learning and doing. So 1 week we had sort of the lecture and the coaching. The next week we had the activity and the coaching. So again, that chef demonstration or walking around the hospital. And we did cover the 6 pillars plus. Now, this has been copied. I worked with Jeff Krause, Dr. Krause, a physiatrist at Stanford. I did grand rounds there, and then he got very interested in the program, and he created one that's very much like Dean Ornish's cardiac rehab Undo It program. It's 4 hours. So I'm telling you, there's a variety of ways to do these group visits and create this kind of community. And this is all in your PowerPoint. And you can see this in the American Journal of Lifestyle Medicine. Again, 4 hours. There's the check-in. They all exercised for an hour together. They ate together for an hour and 15 minutes. There was the lecture and the education piece, coaching. There's mindfulness for 30 minutes. And this group support is where the coaching came in. And Jeff worked with a health coach to actually facilitate this part, as he wasn't a health coach himself. He had physician, health coach, exercise, physical therapist, recreational therapist, chef, and then chef instructor, OT, and nutritionist. The prices varied. It was at the VA at Stanford, and it was free for some of the patients. He had great results showing a decrease in blood pressure, increase in the 6-minute walk test, the 30-second sit to stand, grip strength, and balance among the patients. And then Amy Commander, I mentioned, a good colleague here at Mass General Hospital, who's a breast oncologist. She's been doing these group visits with breast cancer patients. You can read American Journal of Lifestyle Medicine for her summary of her work, but she reports the patient satisfaction and her own satisfaction from doing these groups. So I didn't ever think that I would like this virtual format. Honestly, I never did it until COVID, but now I am sold on it at COVID and at Spalding. I continue, as they ask me to, do these virtually. So it's easier for patients. They don't have to go through Boston. They don't have to pay for parking. They just click it on, and here we are together in their living rooms. This is not them. This is just a stock photo to share. So I recommend it. I have done hybrid where I have some in the room and some on the screen. I do love in person, and when I can do it in person, I do that. But I am now fully sold on the virtual. As I told you, very many different ways to do it. The usual is 12 sessions weekly or 6 sessions. So that's what you'll see in the literature. I tend to think about body, healthy body, exercise, nutrition, sleep, peaceful mind, stress resiliency, attitude and timeouts, and then this joyful heart or spirituality piece with a sense of purpose, social connection, and energy. We're always setting goals at the end of each one of these sessions through coaching. So a part of the program that we do, Paving the Path to Wellness, is setting goals, having investigations and experiments each week, and using variety. Harvard Health came together with me on this Paving the Path to Wellness program, and in 2016, they created a questionnaire. And we do utilize that pre and post. And we have gotten tremendous results, even just in our 6-week program. So the question is, what's optimal, the 6, the 12, and we'll have to continue researching this. But you can see pre is in green and post is in red, and the higher scores mean they're doing better with their minutes of physical activity, better with their stress management attitude. And it is significant in every single category of our 12 dimensions. I have to share with you that most recently, I have been asked to do this with what kind of patient? Physicians. So Mass General Hospital, Center for Faculty Development. I said, okay, I can do this. 6 patients, 6 to 8 patients is ideal. 12, let's say, is max. But hey, if you get 5 physicians that want to work with me and do a lifestyle medicine group intervention, I'll do that. I'll even do it for 4. It doesn't matter to me. But I know from the literature, really, we're looking at 6 to 8 and 12 max. So they sent out a call to the physicians at Mass General Hospital. They said, who wants to do this group coaching? And they had to the physicians had to fill out an application form, and then it was returned in. And I heard that there were 48 applications. So they said, who do you want to take? And I said, well, I don't want to go through these and pick who's what. No, we're just going to do all 48. So we just did 3-4 sessions with the physicians, and it was remarkable and really energizing as the facilitator coach working with these physicians, and the physicians reported increased physical activity. Some started strength training. They increased their vegetable intake. Now, MGH is actually studying this pre and post. So I don't know the results yet, but hopefully if I come back again, I'll be able to share that with you. I believe I got this opportunity because, as I mentioned, in 2018, the Department of Surgery came to me because they had a Frigoletto opportunity. Frigoletto grants used to be available at MGH. A very kind and generous donor gave money for physician well-being. Again, realizing we need to create well-being for physicians, departments, communities, so that they can do their best to help the patients and create healthy communities outside the hospital. So they asked me to come in and inject joy back into the practice of medicine. Well, I love this task in 2018. So what did I suggest to them, knowing the trans-theoretical model of change? Some surgeons are not going to want to do this at all. Some are going to be eagerly involved, and some are going to already be working on their well-being and really want to dive into one-on-one coaching. So what we did was we offered one-on-one coaching. We offered group meditation from Benson Henry Institute at MGH, and we offered them, those that we thought would be in pre-contemplation, not show that they were interested in this, videos that they could do on their own. Turns out about 30 did the coaching one-on-one, about 2 groups of 6, so 12 did group meditation. And then I know this because they emailed me their answers to the video questions. About 30 did the videos. And the videos were the 12 dimensions of the paving program in a half-hour bites that they would take and then answer questions and tell me what their goals were for each one of those. And that created more opportunity. So then it turned into listening sessions for each division and section in the Department of Surgery. So they had me and another coach go to each of the departments and listen to what was going on, what was hampering, what was holding them down for productivity and well-being. And we just completed that. And that has been an incredible experience. If you want to know what your people need and want, hold listening sessions. You heard about coaching. Majority of it is listening. So listening to the people in your team, the people that in your department or section, division, whatever it may be, we ask 3 questions. What's working well? What's an area that you want to work on? So an area of growth or weakness. And then it's funny, we heard about a magic wand, because our third thing was, if we had a magic wand and there was one thing we could do for this section or division that would really change your sense of well-being and your productivity, or one or the other, what would it be? And we just asked those, and we went on for an hour with each, sometimes an hour and a half, with each and every group. Then we also implemented for some of the teams that were struggling, we had another coach go in and work for an extended period of time on coaching that team for enhanced well-being and productivity. I'm just going to end by looking at medical schools. So some of you are teaching, and some maybe you're not as involved in teaching. You're doing more clinical or maybe more research. But just to share with you, these are our future leaders, and helping them understand the 6 pillars of lifestyle medicine will help them for themselves as well as for their patients, as I shared with you with the research I did in 2000 with exercise and physicians. So things you can do. Going from medical school and residency, we can allow for shadowing experiences with medical students when you are working towards working with your patients on the 6 pillars, or if you do start group visits, they can shadow you. Connecting with course directors now that are currently teaching the medical students. This is what we've done at Harvard Medical School, and asked them, hey, do you have a case? Maybe we could add some nutrition or some exercise to your case. Let us know. And after years, there's about 10 of us that are involved in this endeavor now at the medical school. Now there are 6 cases that they have: the pathologist, the pharmacologist, the anatomy instructor, and now us, nutrition and lifestyle medicine, to talk about stroke case, a case of a patient who fell, a case of a patient with OBGYN issues and different issues. So we now are part of that process with the medical students. It's not a full course in lifestyle medicine, but hey, it's making progress. Some schools actually implement lifestyle medicine principles throughout their whole 4 years. We have a thread at the medical school now, meaning a lifestyle medicine thread theme that we try to inject lifestyle medicine, the 6 pillars, throughout whenever we can, like in these cases. Sharing a case. Tell the medical school you have a great case. that shows the power of lifestyle medicine. Maybe it's nutrition, maybe it's exercise, and share it with some of your colleagues in the medical schools, even volunteering to give a lecture, offer to be faculty, to help some of the students maybe with research or a scholarly project. And then we do have a lifestyle medicine residency curriculum at the American College of Lifestyle Medicine, and a lot of family medicine residencies have taken it on. It is online, and we need an instructor to lead the residency curriculum, but this is in addition to their residency work. So a lot of it is online, but they have application activities as well. And I'm happy to talk to you about that if you are interested. You can also go to the American College of Lifestyle Medicine and look up lifestyle medicine residency curriculum, and you'll see all the ways that you can start to apply to get it, that residency curriculum, into your residency. Simple is start a lifestyle medicine interest group. We did this in 2008 at Harvard Medical School with the students, and it has been going strong ever since, and it's really fun. So I teach the exercise, nutrition, stress resiliency at lunch, and provide healthy lunches for the students. So of course they come for the lunch. I like to think they come for the material too. I don't know. Hopefully it's a combination of both, but the healthy lunches certainly bring them in and hopefully keep them there. And I go through all the 6 pillars. You can also do activities with them. We do walks. Many of them, one year, our presidents started a 5K to raise money for that food pantry that's in Revere, MGH, offering the whole food options for those who are visiting the food pantry. We have a ACLM toolkit. If you want to start a lifestyle medicine interest group, you can do that. Go to the website and click on toolkit for lifestyle medicine interest group. You could even have your students apply and win an award, so they could actually win money so that they will have money for these lunches. They could also apply for mini grants from ACLM to get money for lunches. The Donald A. Pegg Award allows for them to use the money not just for the lunches, but for other activities, maybe bringing in yoga or something like that. It's a parallel curriculum, and it's really fun. And you can read about it in this article in Clinical Teacher, where I share the whole process of how you set one up. Now, why do these? That's what I thought back after doing them for 8 years. I said, is this even doing anything? Am I doing anything by doing all this extra parallel curriculum teaching during the lunch and giving these free lunches to students? So we did a little pre and post study, and it was a coaching lecture. So we asked them about transtheoretical model change, stages of change, and their confidence in their ability to counsel before the lecture. Then they had an hour lecture, and we asked them, of course, they're medical students, so they got the knowledge. We thought or hoped they would get the knowledge, but what surprised us in the study is just with 1 hour lecture, their confidence in their ability to counsel once they got into the wards went up significantly, statistically significantly. So we felt like, okay, these lectures are helping them. Now, here's a lifestyle medicine residency curriculum. I was thrilled to be able to offer this to the environmental and occupational residents at the Cambridge Alliance, the Cambridge Health Alliance Hospital here, and it's an HMS hospital, and it's through the School of Public Health. A colleague of mine, Dr. Stefanos Kales, is directing that residency and asked me to come in and help with the lifestyle medicine curriculum teaching. And was it a joy? It was so much fun. These are the residents, and they didn't even have to show up, but they all showed up for every session. And we really had such a great time. I started connecting them with the medical students, bringing them, these residents, into the journal club and creating community so that the medical students could see what the residents are doing. The residents could see what the attendings are doing and what the journal club is all about. And it really was just a tremendous joy. So I just had to share that with you. We need to take care of the medical students, the trainees, and the early career physicians. Get them on track with the work-life harmony right from the get-go. Fortunately, Department of Surgery, they thought of this, actually. They were the ones, Rich Hoden, who directs the mentorship program at the Department of Surgery at Mass General Hospital. He said, hey, Beth, would you come in as a lifestyle medicine specialist when we do our mentoring and bring that well-being into the mentoring session? Oh, it was like, I didn't think of it. It was a brilliant idea that they had. So then all the early career surgeons, I would come in And surprisingly, the surgeons that ran the meeting would say, "Oh, we have Dr. Frates here with well-being and lifestyle messages. Make sure she gets half the meeting." I'm thinking, wow, these guys get it. And women, there are women in the Department of Surgery there. These people get it. And then I would offer coaching with the early mentees. And then they would sign up for the coaching. We talk about exercise, nutrition, sleep, and the whole work-life harmony. And it was just a tremendous opportunity. And I'd love to see this go into other departments. I haven't seen that yet. I shared with you Erica Frank's work. Remember? Maybe you were there or not, but one of your colleagues asked about or mentioned that she was sharing her personal behaviors with her patients. And I shared that this study shows if you bring in an apple and you tell patients, I know it's hard to get fruits and vegetables in, but I bring this apple in for a treat, and it's hard to get physical activity in. Here's my bike helmet. I bike into work. They were motivating and believable compared to the other group, remember, that didn't do the coaching. They finger wagged the patients for that same period of time. The others disclosed their behaviors. Here's the study. And we're at the end. So here's the study I shared with you that I told you I'd give you at the very end. And this is the personal exercise habits and counseling practices of primary care physicians, a national survey. Believe it or not, this has gotten the most play of anything I've ever done and been replicated many times. And it was just 298 primary care physicians. So 84 were family practitioners, 79 pediatricians, 58 geriatricians, and 77 internists. And you got the results. Interestingly, they reported that they did not counsel on exercise. If they did not counsel on exercise, most of them said they didn't have enough time. So group visits would help with that. And they said they didn't have enough knowledge or experience. So that study from 2000, now we're in 2023, but it's still so important because if we're going to build healthy communities from the inside out, where do we have to start? With that connection to self. We have to think about what we're doing with our 6 pillars, with our own lifestyles, and how that may impact our counseling and our ability to motivate and our ability to coach people to adopt and sustain change. So I'll just end here with a great quote that I really love from Gandhi. They say Gandhi said it, and some say, well, no, he didn't actually say that. But anyway, be the change you want to see in the world. I firmly believe in this. I want to see more health. I want to see more joy. I want to see more exercise. I want to see more people eating kale and broccoli and cauliflower. So I'm going to do these things too. All right. That's my summary slide. Just says, let's get together, create healthy communities. I'm delighted to have been able to participate in this again. Thank you so much for allowing this Zoom so that I could basically be in 2 places at once. And thank you so much for this opportunity. Appreciate it. I'm not sure if you have a question and you still want to stay on. I'm certainly going to stay here for you. Oh, I see there's something in the chat. So having worked with several hospital administrators who are lacking in these lifestyle skills, I think that they should be integrated into the education. Very good. Into the educational meetings, projects, as their acceptance makes a difference. I completely agree with that. And it just says iPhone, so I don't know your name, but thank you for that excellent comment. And I agree with you. And you know what's interesting? The CEO of Spalding was David Stordo. And when I first started doing this or getting traction at Spalding, maybe this was like 2012 or so, 2014, he invited me to the administrators meeting to do a Paving the Path to Wellness workshop for the administrators. So that's brilliant. And I should put that, I thank you, because I should be mentioning administrators when I do this in the future. Any other thoughts, comments, questions? Thank you so much for being here. I know it's late on a Friday. It's incredible that you're here, and it's 6:30 for me. So for some of you, it's 6:30 also. So any other questions or thoughts? So Mark, I see you. Thank you for being present. And I hope you enjoyed it. Okay. If there aren't any other questions or thoughts, you could always chat them in, or you can unmute.
Okay, thank you.
Anybody?
Okay, Beth, thank you so much. We really appreciate your time that you've spent with us, and this has been just an outstanding kind of cap on the top of our wonderful meeting, just to know that how, we can take care of ourselves. It improves the way we take care of our patients as well. So thank you for providing that for us.
Oh, thank you so much for having me and being so flexible and letting me contribute. It's really an honor. And I do hope that people can reach out to me. If they have questions, please do share my information.
Okay.
If people want to connect, I'd be more than happy to connect with people that have attended this conference. So thank you so much for the opportunity.